Good morning. Good morning, and thank you so much for joining the Youth Camp Operator Training. Just going to allow folks to trickle in. We appreciate the time. Good morning. Can you guys hear me?
Yeah, I can hear you.
Yes.
Okay.
Yes.
Yes.
Okay.
Yes, we can.
Yes, we can hear you.
Fantastic. Okay. Thank you.
I can hear you.
Right.
Yes, I
Just
can hear you.
perfect. This reminder: this meeting is being recorded. I ask that everyone mute your lines so that we don't have any interruption in the process. I thank you for the confirmation that folks can hear me. We have quite a few topics to cover today. We're just going to allow a couple of more minutes as we admit folks into the training. Again, reminding you to please mute your lines. Please mute your lines.
Where are you?
And we'll get started shortly. Again, welcome to the Youth Camp Operator Training. Still letting folks in. Please mute your lines. This training is being recorded.
No.
And
just
yeah, go co-administrators. If there's any possible way to mute everyone, if you could do that for me.
Oh, I've been hitting it as it pops up.
Thank you.
But as a reminder, if you are experiencing lag during this call and you have your video on, Teams will get slower with large calls and video. So you may want to turn off your video for the duration of the call just to prevent lag.
Okay. Okay, I think we'll go ahead and get started. Share my screen. All right, good morning, everyone, and thanks for being here today. My name is Danielle Clemens, and I'm the project coordinator for the New Jersey Department of Health Youth Camp Safety Project and Public Bathing Projects. On behalf of our team here at the NJDOH, I'd like to thank you all for taking time out of your busy day to join us for this training. Excuse me, please note that this webinar is being recorded and will be made available shortly after the session. If you have any questions during the presentation, please use the Q&A function to submit them. Toward the end of the training, we will go over a selection of questions live as time allows. Any unanswered questions will be addressed in the FAQ document that will be shared with all registrants after the session. Thank you again for being here. But before we jump into the training, I want to start off with a quick interactive exercise to get us thinking about why we're all here. If you can please take out your phones and scan the QR codes to participate.
Oh, Danielle, your presentation is not being shown.
Is not being shown. Okay, just 1 second. Sorry. Let me.
Hello, everyone.
Oh, not that one. Can you see it now?
Yes.
Perfect. Okay. If you can scan the QR code, you can participate in the poll. First question is, what does a great camp experience look like for your campers? So let's get let's see. We got some fun, making new friends, enjoyable, engaging, fun, being the biggest, safe. We at the Youth Camp Safety Project love safe, exciting, engaging, fun and safe, new memories, and connection. I love connection. Again, it's really gets at the root of what youth camp environments provide for students. New experiences, connection with others, feeling safe when they're not at home. Thank you for that. Let's go to the next one. Okay. Technical difficulties, just 1 second. Am I still sharing my screen or no?
Mm-hmm.
I am. Perfect. See how I get there. What makes camp feel safe to you? I know we have a lot of different roles assembled here. We have camp counselors, we have camp operators, directors. We have, school bus staff. We have all types of folks who contribute to the camp organization. So what we're seeing about what makes camp feel safe to you, well-trained staff, the rules, structure, enough staff. That's always a challenge. Supervision, responsible staff. Yeah, we're dealing with 16 to 21-year-olds who may at times not be the most of responsible folks. They're getting there, but they just sometimes aren't there. So caring staff, solid protocols, healthy, structured. I love all of these ideas about what makes camps feel safe to you. Thank you again for participating. Last question. You can pop in the chat. What's one thing you're hoping to get out of today's training? Anne and Janelle, would you mind reading some things off of the chat to see what folks are hoping to get out of this training?
All right, we've had clarity popping up a fair amount of times on protocol, some background knowledge,
Yeah, understanding the new rule changes.
That makes sense.
Mm-hmm.
That makes a lot of sense.
Some best practices, full understanding of expectations. So
Yeah. Okay. So sounds like we're all here to learn a lot and get some clarity on some cloudy things here. But I'd like to point out that the connection here is that multiple folks on this call, and in those not on this call, want to make the camp feel safe, um, like instilling trust and supervision, and those are exactly the things that help folks have amazing experiences at camp. Safety isn't separate from the camp experience. It's what allows everything else to happen. So fun, learning, friendships, growth, all those things work when campers feel safe. And I know from experience and from many of you in this room that keeping camp safe isn't always simple. As many of you pointed out earlier, there are real challenges like staffing, supervision, weather, unexpected situations, and you're making decisions every day that impact the well-being of the campers under your care. That's exactly why these standards exist. The NJAC 8:25 U Camp safety standards were created to promote, protect, and safeguard the health and well-being of every child attending camp here in New Jersey. They're not just regulations, they're a framework to help support you in creating this safe environment, consistency, high quality environment for every camper to thrive. And they provide something really important beyond camp itself: confidence. Confidence for parents, confidence for camp communities, and for all of us. That camps are operating with safety as a priority. So today our goal is to walk through these standards in a way that is practical and relevant to your roles. Not just what the standards are, but what they look like in action and how they support the work you're already doing every day. To the next slide. Now that we talked about what makes camps great for our campers and what keeps them safe, let's look at the first piece of making all of that possible, which is certification and administration. These are the foundational requirements that ensure camps are not just fun, but officially equipped and prepared to protect every child under their care. Many of you know, and if you don't know, there is a licensing requirement in the state of New Jersey. If folks could please double check to make sure that your lines are muted. Again, this is being recorded. Please mute your lines. Thank you. In order to become a youth camp in New Jersey, the first step is to ensure that you're meeting the licensing criteria. A program must include at least one high-risk activity. Examples of that would be swimming, rock climbing, zip lining, horseback riding, archery sports, animal farms, or similar activities. They must operate for 2 or more consecutive days during the week. Run for a minimum of 3 hours per day and serve 5 or more children under the age of 18 in recreational or educational activities. Just 1 second. Getting ahead of myself. High-risk activities. This is probably one of the most frequently asked questions. What is a high-risk activity? So high-risk activity is any recreational activity that exposes campers to a significant risk of serious injury or illness due to its inherent hazards. Examples, again, horseback riding, rock climbing, zip lining, riflery, contact or intense sports, aquatic activities. And considering the age of the camper, dancing, um, sports, flag football. We know that there are concussions associated with sporting activities. So um, any any activity aside from a sedentary activity like gaming could be considered a high risk activity. I want to point out that STEM activities, thinking about where folks maybe make rockets or some other chemical reaction could be involved. Those would be considered a high risk activity as well. Youth camp types. Camps come in different forms. There's day camps where the campers return home each day. And then there's a resident camp where children stay overnight. This certificate confirms that your camp has applied and meets the minimum safety and operational standards before a single camper arrives at your camp. Inspectional activities to verify you're operating in line with the standards will be discussed later in this presentation. Other entities or unlicensed activities are also exist in New Jersey. It's important to note that organizations that do not meet the licensing requirements discussed before are not required to register or obtain a license with this youth camp safety project. There are also instances where organizations such as DCF, Office of Licensing Childcare Centers, may operate under dual licensing, meaning they could hold both a childcare license and a youth camp safety license. It's strongly advised that any childcare center contact their OOL inspector before applying for a youth camp safety license to discuss dual licensing requirements and avoid any regulatory conflicts. Listed here are some additional entities that are not required to license, like municipal camps. In New Jersey, municipally run camps are not required to register as youth camps, though they are encouraged to do so when appropriate. Other organizations that don't meet licensing requirements could be a school. We consider them municipally run organizations. So a school does not have to register for a license. Camp licensing requirements continued. The licensing process overview is that renewal applications should be submitted by May 1st. So if you operate a youth camp in the past, you want to submit your renewal application before May 1st. New applications should ideally be submitted at least 60 days before opening day. Our licensing process currently, because it's the beginning of the season, I'd say it takes about 2 to 3 weeks for your applications to be processed. So you want to allow for our staff the time to process yours and other applications. Once your application is processed, your license will be emailed to you at the email in which we receive the application. Once you receive your license, camps must contact their local health department in the jurisdiction of operation to schedule a pre-operational inspection. Camps that are accredited by the American Camp Association are not required to have a pre-operational inspection. So, if you are an ACA accredited camp, once you receive your license, you are clear to operate and no other action needs to be taken. If you are not, again, please contact your local health official to schedule your pre-operational inspection. How to submit your license application. You want to go to our website and download the CB11 form. You want to make payment on the payment portal. Please complete all of the fields in the form, including the payment section. Attach all of that documentation, which includes the application form and the payment receipt. Email that to youth.camps@doh.nj.gov for processing. Excuse me. Our internal firewalls reject foreign unknown links. In fact, sometimes the emails containing these links are not even delivered. So please do not send any links to Google Drives or Gmail for your application showing proof that you've paid or the application form. This is a cause for security reasons, and we're unable to access anything related to Google Suites. So please attach actual PDF forms to your email. Links will be rejected or not received. The camp director is central to safety and operations. Their responsibilities include ensuring staff are trained, overseeing the staff operation of activities, maintaining required documentation, implementing emergency procedures. So what you want to think of the camp director as the person making sure that the fun experience and the safety experience are happening at the same time. Staff background checks and sex offender registry checks. Pursuant NJAC 8:25-3.2 J through L, you'll see that resident camps are required to conduct fingerprint background checks via the New Jersey State Police, 50 state background name checks, and nationwide sex offender registry checks. Similarly, day camps are required to conduct the 50 state name background check and the sex offender registry check. Now, the fingerprint background check and 50 state background check are only for adults who are 18 and older. The sex offender registry check is required for all staff, 16 and older. Your procedures for conducting background checks need to be clearly written and documented. You also want to make sure all related records are kept for at least 3 years. When it comes to writing procedures, the best practice is to have the person who actually performs the task documenting it step by step. This helps to ensure that the process reflects what really happens day to day. When procedures are accurate and practical, it reduces confusion and makes it easier to answer questions that come up during the inspection. It is important to note that the goal of these reviews is not to penalize simple or straightforward processes. Instead, the focus is on identifying any gaps and helping you to understand where improvements might be needed. Finally, make sure your background check documentation is readily available on site at the time of the inspection. Being prepared ahead of time helps everything go a lot more smoothly. So again, the background check requirements were modified and go into effect in June of 2026, this summer. A newly defined term is the fingerprint-based criminal history background check. It's a fingerprint check of criminal history specifically for staff in a resident camp setting. impact. Again, it applies to adult resident overnight camp staff in positions involving unsupervised access to children. The fingerprint check must be obtained from the staff member's home state or country. It is the responsibility of the camp operator or director to conduct these checks, and documentation must be maintained on site. On file. And a little color about this is to the New Jersey's requirement for fingerprint-based criminal history record information represents one of the most rigorous and protective screening standards in the country. For out-of-state and international staff, we recognize that the specific framework New Jersey uses for non-FBI-based employment fingerprinting is not currently available outside of the state. As a result, out-of-state and international jurisdictions may not have the infrastructure to replicate New Jersey's exact process. As of now, we're working with the Office of Legal and Regulatory Compliance to help provide guidance on out-of-state and international background checks, fingerprint background checks. As soon as that information is received, we will post it on our website and forward it to registered youth camps. The 50-state name-based criminal history check is a modified requirement. It applies to all youth camps, both day and resident camps. Adult staff in positions involving unsupervised access to children must conduct a 50-state name-based criminal history check. Camps must use a vendor that provides information at least comparable to the New Jersey State Police by conducting a name-based criminal history check covering all 50 states, ensuring the scope is substantially equivalent to the New Jersey standards. The 50-state name-based check for international adult staff, what you want to do is obtain a countrywide name-based criminal history check or a recognized equivalent from the staff member's country of residence to the extent practical. Another new provision introduces an alternative pathway for background check compliance for certified school personnel. Under this update, teachers who are currently employed by a school district may not be required to undergo an additional background check for camp employment, provided specific conditions are met. In place of a new background check, the teacher may present a notarized statement from their school principal or superintendent. The statement must attest that the individual is currently employed by the district, has already completed the required criminal background check, and remains in good standing. As a camp operator, you may accept this notarized documentation in lieu of conducting a separate background check, as long as it meets all the outlined requirements. It is important to note that this is not an automatic exemption. If you are responsible for verifying that the documentation is complete, properly notarized, and includes all the required attestations. This documentation should be maintained on file as part of your staff records and made available upon request during inspections or compliance reviews. This provision is intended to reduce duplication while still maintaining the integrity of the background check process and ensuring the safety of all campers. This next provision outlines a similar pathway for non-teaching school personnel who have already completed a criminal history background check. Certain school personnel, such as aides, support staff, or other district employees who have undergone a fingerprint-based background criminal history check may be eligible to forego an additional background check for camp employment. However, unlike certified teachers, this process is not automatic and requires prior approval through the New Jersey Department of Health Youth Camp Safety Project. To utilize this pathway, the camp operator must submit a formal waiver request to the department's Youth Camp Safety Program at youth.camps@doh.nj.gov. This request must include a notarized letter from the school principal or superintendent, similar to the teacher provision, confirming that the individual is currently employed, has completed the required background check, and is in good standing. In addition, the waiver request must satisfy all requirements outlined under NJAC 8:25-1.4 as detailed on this slide. I'm sorry, on the next slide. Approval must be obtained before the individual can begin working without a separate background check. It's important to emphasize that until the waiver is reviewed and approved by the department, the individual cannot be considered cleared under this provision. As a camp operator, you are responsible for ensuring that all documentation is completed, submitted properly, and retained for your records. Here is the actual waivers of standard provision. If you're a camp operator and you plan to submit a waiver of standard on behalf of other school employees, it's important to follow this direction. Section 1.5 provides the specific requirements and details for submitting the waiver. This includes what information needs to be included and how the request should be documented. Be sure to review this section carefully before submitting the waiver, so you can ensure everything is complete and meets the required standards. This will help avoid delays and make the review process a lot smoother. The fingerprint-based background checks should be conducted by the New Jersey State Police, who retain Identigo for background check services. According to the New Jersey State Police, results are returned within the 24 to 72 hours after the date of scheduled fingerprint appointment. To download the personal record request letter, applicants and/or employers would need the Identigo PCN number, the last name of the applicant, and the date of birth as entered on the Identigo form to be authenticated. Info will be held up to 90 days. Beyond 90 days, you will need to redo the checks, which means you will need to print out or save documents of these personal record request letters to verify that your applicant has been properly vetted. Again, the New Jersey State Police will not be sending you documents. You will need to go to their website, download the personal record request letter, then save that document for verification purposes. Currently, the state contracted vendor Identigo has 18 static site locations. The state vendor also offers the ability to schedule mobile fingerprinting operations at various locations. For more information, you'll want to contact Identigo. I do have a link to Identigo that I'll share in the Q&A at the end of the show, or in the chat at the end of the show. If your background check does uncover a result and identifies a criminal history result, it'll be mailed to the employer's address. That's the only time documents will be mailed, is when a result or a hit is received. Now let's talk about the 50 state name checks. These checks can be conducted by any vendor that offers the service. However, it is the responsibility of the camp operator or director to make sure that the company you choose has the capability to search all 50 states, including New Jersey. In addition, sex offender registry checks should be conducted on a national level, not limited to a single state. Taking these steps ensures a more thorough screening process and supports the safety of your program. New in the rule are listed counselor disqualification updates. Youth camp operators and directors must verify that their staff are free of disqualifying convictions in New Jersey or any other jurisdiction. Disqualifying offenses are serious criminal offenses such as violence, abuse, or crimes involving children that make an individual ineligible to work in a camp setting. These standards are in place to protect campers. Staff are in positions of trust, and thorough screening helps ensure that those who may pose a risk are not placed in roles working with children. Some disqualifying offenses newly listed in the rule are murder, child abuse and neglect, crimes against children, spousal abuse, rape or sexual assault, kidnapping, arson, physical assault or battery, drug-related offenses within the past 5 years. Ultimately, this isn't just about meeting the requirements. It's about creating a safe, secure environment where campers can have a positive experience. Developing a background check screening policy. Your written policy should include the following components: the type of background checks you're required to conduct, whether you're a day camp or a resident camp. You want to have something in your policy that talks about the vendor, ensuring that the screening the vendor conducts is in line with New Jersey regulatory requirements. You want to maintain that documentation from the screening company, outlining the screening criteria and the databases that they search. Verify that all required disqualifying offenses are included in the screening scope. Ensure that no individual is placed in an unsupervised role until background checks results are received and reviewed. Let's go briefly review some ways to demonstrate compliance with these background check standards. Section 3.2 outlines the required policies and procedures that camp operators and directors must develop and train staff on, which we'll talk more in depth about later. But some of these include policies related to personnel, camper discipline, mandated reporting, and daily health surveillance. Now is the time to start developing or updating your policies and procedures that will be implemented at your camp. These documents should be organized in a clear, accessible binder or digital equivalent and used as a training resource during the required preseason staff orientation. It's important not to include detailed criminal history on this verification log, as not to compromise your staff background information. I'd also ensure that all folks that completed background information checks are included on the log and their eligibility status. This ensures that you have a comprehensive record of those folks who were vetted and the outcome of such checks. It's perfectly fine to have a rolling roster of currently employed staff and a second and/or third roster for staff who weren't hired or those who are no longer with your organization. It's important not to include detailed criminal history information on the verification log in order to protect the confidentiality of the staff background information. Now, we've been asked if we have a sample document for the verification log, and we do not. But again, if you're creating your own verification log, using these points could be a great way to build your verification log, making it accessible to the inspectors upon inspection will speedy up your inspection process. Store the full background check reports securely. Maintain complete background reports in a restricted access file. Limit access to designated administrative personnel to protect the records. And you can also include them or protect physical records or documents in a locked encrypted system. Be inspection ready. Provide verification log during the inspection. Maintain documentation. Example, a verification log, the invoice from a third-party vendor that your background checks are being conducted. You can use that as verification documentation for your inspection. All of the key changes of the youth camp safety standards were communicated in a training hosted just a couple of weeks ago. The training was recorded and the video has not yet been released, but will be released and posted on our website as soon as approvals have been received. Currently, the video is snaking through our approvals process, and we hope to have it posted soon. Staff training. All staff must receive training that aligns with the camp's activities and safety requirements. Training ensures that everyone, from counselors to lifeguards, know their responsibilities and how to respond when something unexpected happens. Documentation of the orientation is key to ensuring you have a method of showing your compliance with the standards. The orientation documentation requirements are to document the date and time of the orientation, include a list of all attendees and an agenda with the training records, retain copies for any written exams or certification trainings completed by staff. Another part of your training should include communication that anyone at the camp can be a mandated reporter. Camp operators should educate their staff about reporting abuse and neglect to 1-877 NJ abuse. Other topics that can be found pursuant to subsections 2 and 3 of the rule are supervision ratios, which we'll discuss later, and requirements of liability insurance. Required records and documentation should include staff qualification, background checks and training, camper attendance and medical information, safety inspections and activity logs, and camper operations and health policies and procedures. Now, I can't stress enough the importance of organized and accessible documentation demonstrated within centralized inspection binder, clearly tabbed and labeled. Camps must maintain records on staff qualifications and training, those attendance medical information, safety inspection, and activity logs. Documentation isn't a bureaucracy. It's proof that we are following the standards and we can respond effectively in any situation. Any serious incident must be reported to the department within 24 hours. This includes outbreaks of communicable disease, death, and serious injuries. Prompt reporting helps prevent further harm and allows the state to provide support if needed. Remember, the faster you report, the safer everyone is. Now that we've talked about incident reporting, especially related to outbreaks and communicable disease, I want to take a moment to focus more specifically on what that looks like in practice. Because when it comes to keeping campers safe, prevention and early response are absolutely critical, especially in a camp setting where illnesses can spread so quickly. To help bring this to life, I'd like to introduce Tiffany White and Nicole Lamb of the NJDOH. They'll be speaking about communicable disease service and sharing practical tips on how to keep kids healthy this summer in your camps. Tiffany, I'll turn it over to you and feel free to share your screen.
Good morning, everyone. Can you see my screen?
Yes, your screen is shown.
Okay, perfect.
Perfect, thank you. So thank you, Danielle, for that introduction. Again, my name is Tiffany White from the New Jersey Department of Health School Health Team. And also on the call today is Nicole Lamb, our School Health Team Lead and Epidemiologist. So New Jersey Administrative Code 857 requires the reporting of specified communicable diseases and outbreaks in New Jersey. The regulations provide guidance on the reporting and investigation required for each listed disease and condition. And they can be found, information about reporting can be found at the link noted on the slide. Also on that same website, our CDS reporting page, you will find our quick reference list of reportable diseases. Reportable diseases are separated into two categories, those that are immediately reportable and then diseases that are reportable within 24 hours of diagnosis. Outbreaks and suspected outbreaks of any illness, even if that illness is not listed here, are immediately reportable. In fact, most of what we see in the school and camp settings are not illnesses or diseases that are reportable on their own. So who should report? Healthcare providers and medical facilities, veterinarians, correctional facilities, youth camps, which applies to you all on this call today, daycare centers, preschools, schools, and institutions of higher education. Laboratories report positive tests into our CD surveillance system, and this is the primary way that we get reports of reportable diseases in the state. So outbreaks and suspect outbreaks are immediately reportable to the local health department where your camp is located. Those reports should be made by phone. You are reporting to your local health department because communicable disease activities must be led by a licensed health officer, and the authority to investigate and control communicable disease is on the jurisdictional level by that local health officer. In the event that your local health department cannot be reached, the report should be made directly to the State Department of Health. During business hours, you can use the first phone number, 609-826-5964, and if you're making the call after hours, you use the 609-392-2020. So who is your local health department? They're a partner to keep your attendees, students, and staff safe and protected. They're also a guide for your facility during a suspected or confirmed outbreak. And they're also a resource for infectious disease concerns and updates. If you are unaware of who your local health department is in your jurisdiction, at the link noted, you can access the local public health directory and enter the address for your camp, and then the contact information for the local health department in that jurisdiction will appear. So this is the general guidelines for prevention and control of outbreaks in camp settings. This is a very robust document that was last updated April 2025. It's roughly 41 pages. This document is developed to guide your local health department as well as you through outbreak investigations and has, like I mentioned, a ton of information inside. It also contains helpful information about how to prevent and control infectious disease spread in your camp. It does have a dynamic table of contents, so you can hover over which section you like to go to and go directly there. So here I want to highlight some information that can be found in that outbreak guidance document. It's information about communicable disease reporting, case investigation, outbreak prevention, how to prevent vector-borne illnesses, residential camp information, control measures, sample exposure letter notifications. There's an exclusion list, an outbreak checklist, and vector-borne disease prevention resources and activities. So I also wanted to give a general reminder to always report increases in illnesses to your local health department. So here's how to identify an outbreak. As I mentioned, outbreaks and suspected outbreaks are immediately reportable, even if individual cases of the illness are not. Your local health department can help you differentiate between baseline illness and suspicious increases. Anything, excuse me, sorry, the slide is acting a little funny. 1 second, okay. So anything, any increase that looks unusual to you, it's important for you to give your local health department a call. They're there to help you to determine whether or not you have an outbreak that's occurring. An outbreak is defined as an occurrence of a disease greater than expected at a specific time and place. Some key red flags to look for are several children who exhibit similar symptoms, who are in the same group or cabin, in the same wing of a facility, or they attended a common event or activity. That there's an increase in absences, with many parents reporting similar symptoms as the reason why their child is not attending camp. And of course, in general, if you are notified of a highly infectious reportable disease, you should call your local health department for guidance. So what is your responsibility as a camp administrator or a camp administrator during an infectious disease outbreak? Not only is it to report, as mentioned, to your local health department, but also to provide that local health department with routine updates. Your LHD will guide you on how often you need to provide an update, since not all outbreaks are the same. Communication is key, both with your local health department as well as with parents before and during an outbreak. And any notifications about outbreak or increases of illness that you are sending to parents should be done in collaboration with your local health department. So when reporting a suspected outbreak, a few key pieces of information will be requested. First and foremost, you'll need to know your current camper and staff census, along with a number of ill individuals. It is also helpful to know the number of groups or cohorts that are affected by the illness, as well as when was the first reported illness. This can be difficult to determine, but giving the local health department a rough idea of when this outbreak could have potentially started is very helpful. It is also helpful to know when the most recent case became ill. Another key piece of information to give the local health department is any known diagnosis or laboratory test results. If no test results are given by the parents, symptoms can be very helpful. This is typically the information we rely on, since, as I mentioned, most of what we see in camp is not reportable, and therefore testing has not been done. So on our school's health page, we have both in Excel format and in Google Sheets what we call a line list. Um, this line list is meant to be used if an outbreak is suspected or identified. It's important to note that this is not meant to be an overall illness log for all reported illnesses in the camp. It is important to include as much information as possible for each camper or staff, including their demographic information, the grade room or cabin, and all known symptoms. If you do know the onset dates, please include that information. It's critical. And if a symptom onset date is not available, the first day of absence can be used. If test results have been provided or the diagnosis has been provided by the parents, those should be included on your line list as well. If you think you are experiencing multiple types of outbreaks in your camp, such as an outbreak of suspected norovirus and then also an influenza outbreak, it is very important to keep 2 separate line lists for those illnesses. Here is just a screenshot of what our exclusion list. It is located at the end of the guidance document. The total exclusion list is about 8 pages. This is updated regularly, so it's important to check our website to make sure that you have the most updated version. So notifications. Prior to camp beginning, policies should be created on how and when to notify both parents and staff. For both outbreaks and certain communicable diseases, your local health department may recommend sending a notification. It is important to discuss who will receive the notification, such as particular groups or grade levels. Not every instance of illness may require a notification, and your local health department should be consulted prior to sending one out. They can help provide templates and ensure that the correct information about a specific illness is included. So here's a brief overview of reported outbreaks in New Jersey over the past 5 years. As you can see in green, we've had mostly COVID outbreaks that have been reported by camps. And in 2021, there was a spike in outbreaks, and it has since gone down if you look at last year. But last year, we had a hand, foot, and mouth disease that was reported. On our school's health page that I mentioned, there is specific information and guidance documents for diseases such as hand, foot, and mouth disease. So a little bit about respiratory illnesses. While COVID-19 remains a concern, influenza, RSV, and traditional seasonal illnesses such as rhinovirus and adenovirus are going back to pre-pandemic rates. These viruses share transmission methods, symptoms, and prevention strategies. CDC provides clear steps to limit the spread when individuals are ill, regardless of the specific virus. To address this change and the similarities between respiratory illnesses, the Centers for Disease Control and Prevention, also known as CDC, has released new respiratory guidance. Exclusion remains the same for all of these seasonal respiratory illnesses, as do all other public health measures. So when that respiratory guidance was updated by CDC in August of 2025, we also updated our respiratory guidance. And this is a screenshot here of that guidance document, which is also very robust. We also have for you another guidance document. We've seen an increase of avian influenza, also known as bird flu, in wildlife and animals. So with many camps spending time outdoors, this is a resource for you if you were to encounter a dead bird or how to proceed in that event. Here's also information about measles in terms of preparing for measles. Uh, Review immunization status of all enrolled students and have documented proof of immunity or exemption to measles. Encourage staff to confirm that they have documented proof of immunity to measles. Be prepared to quickly identify and provide a list of children and staff without documented evidence of immunity to measles in the event of an exposure, and establish a relationship with your local health department, as was mentioned earlier. This is also a screenshot of the CDC's preparedness checklist for measles, and we'll provide you a link to that information in the chat. And these are two other additional resources for measles. The New Jersey Department of Health will post exposure notices on our page, our measles page here, and the right side is the document on the right side is an example of that. As I mentioned earlier, this is our school's health page where you can find multiple resources. And we also encourage you to sign up for links messages if you are not already. Links is our New Jersey's version of the Health Alert Network. It's called NJ Links. It is an internet-based, interactive, statewide network of online electronic public health information for public health professionals and partners. Access to links is available to all local health departments through links-led agencies to be able to access data and information for surveillance, analysis, and identification of disease and injury trends. Other functions of links is on a countywide public health planning with the participation of local health departments and community partners. And it has a regional capacity to respond to incidents of disease, environmental conditions, and events which threaten the public's health, and for the coordination, triage, and dispatch, and deployment of staff to urgent, emergent, and routine public health threats. We also wanted to share some vector-borne education resources for your camps. These resources explain the importance of protecting yourself and campers from mosquito and tick bites. So far, 3 items have been created and there's room for more. The current resources consist of the following. We have a flyer that's aimed for camp counselors and workers and campgoers. We also have a flyer aimed for parents and guardians who are sending children to your camps. And we have an activity sheet for younger campers to use for educational purposes. So here, this is just a preview of those materials which can be accessed within the camp guidance document towards the end. The first one is for the campers and counselors, while the second one is more comprehensive and aimed at parents. And then this is that camper activity sheet, which can be a great activity for young campers to do on a rainy day or even before an outdoor activity to increase their knowledge on how and why it is important to protect themselves against mosquitoes and ticks. And we thank you for your time and we wish you a safe and healthy camp season. We'll put our school health email in the chat should you have any questions, but your local health department really should be your primary contact. Thank you.
Thank you so much, Tiffany. Such important information there. I don't know if, did you guys want to answer questions that are in the Q&A or did you? I can't.
There's
I
no
have
current
one.
questions in the Q&A right now,
Okay.
Danielle.
All right, perfect. If you guys have questions for Tiffany and Nicole of the Communicable Disease Program, please drop those questions in the chat. Give a couple of minutes to allow folks to drop any questions you may have about outbreaks, outbreak response. Again, as Tiffany indicated, your primary contact is your local health department. Right. Well, thank you guys so much again for that information, Tiffany and Nicole. I appreciate you guys participating and getting our campers, our camp operators, and camp staff ready for the upcoming season. So, yeah. Go ahead.
No, I just saying thank you.
Yeah, go ahead. You're just saying thank you. I got you.
Yes, that's it.
Thank you. All right. Next on our agenda is a brief break. I am so proud of what we are doing here. We are really on time. So let's keep it going. We're going to take a 10-minute break. I'll see you back here at 11:25. I'm going to repeat what I said about the health director being the most important, one of the most important roles in your camp. So let me share my screen again. Just one moment. Thank you, Anne, for keeping me honest and organized.
I mean, it's why you pay me the big bucks, 50 cents an hour.
That part. So
Don't worry, everyone. I make at least minimum wage.
So the health director requirements. At a day camp, an adult must be certified in basic level first aid. At a resident camp, there has to be, the health director has to have a registered nurse license, licensed practical nurse license, licensed physician, board certified athletic trainer, emergency medic, EMT, paramedic, someone certified in advanced first aid or first responder activities like a lifeguard. The requirements, as you can see, differ between day camps and resident camps.
You're not sharing your screen yet.
I'm not.
No.
I see it, Danielle.
Yes, same here.
Okay.
Oh, then ignore me on this one.
Okay, perfect. Thank you, guys. Okay. For day camps on site at all times, the requirements are different, but the requirement is basic level first aid to respond to injuries and health concerns. For resident camps or overnight camps, there must be a qualified medical professional as listed. Please be sure to review the regulation at subsection 5 for specific requirements as it relates to your type of camp. Campus staff health records are also required to be maintained on site. They're required to maintain immunization records, medical and or religious exemption documentation for campers, and a health history for both campers and staff. These supporting documents help to support the health director's role in our health records. These records help identify risk, guide decision-making, and ensure that everyone can safely participate in camp activities. Going back to what CDS was talking about as far as as it relates to outbreaks, if there is a suspected outbreak at your camp, any camper lacking proper immunizations for a potentially reportable disease would have to be excluded from your camp activities. Medication administration and documentation. Anytime medication is given at a camp, it must be properly authorized, stored correctly, documented every time it's administered, and to ensure that the consistency, accountability, and most importantly, camper safety is followed. As we heard earlier, camps must have clear procedures for addressing communicable disease control, including recognizing symptoms early, You can do this by documenting when illnesses happen at your camp. When the health director documents what injuries or illnesses a camper comes in for, monitoring that log to ensure that you're not having repeated instances of the same types of communicable disease related illnesses, can help you identify and recognize symptoms early. You want to take appropriate action, like separation if necessary, and follow reporting requirements. Quick informed decisions here can prevent larger outbreaks. Your local health department is your primary contact for outbreaks. They should be contacted in the event of a suspected and confirmed outbreak and will help your organization implement steps to curb the spread. Additionally, the NJDOH Youth Camp Safety Project should be contacted within 24 hours of an outbreak and immediately when a serious injury or death occurs at your camp. All of these elements, led by the health director, work together to create a safe and responsive health environment at your camp. Required emergency plans. So let's talk about how we manage health on a day-to-day basis through staff records and procedures. But as we all know, camp environments can be unpredictable. That's why the next section focuses on something just as critical: emergency preparedness and safety. Emergency preparedness is about being ready for situations that we hope never happen, but need to be fully prepared for if they do. The key here is not just having a plan, but having a plan that is clear, practiced, and understood by your staff. Under the standards, camps are required to have plans in place for a range of emergency situations, including active shooter or lockdown situations, fire or disaster, serious injuries, lost camper, lost swimmer, and communication with parents and guardians, like example, reunification plans. Each one of these plans should clearly outline roles, responsibilities, and steps to take in the moment. Having these plans in place ahead of time is so important because it allows staff to act quickly, confidently, and in a coordinated way when every second counts. As we know, plans and pieces of paper themselves are not enough. You must implement drills and practice your plans. They help staff to understand their roles, to identify gaps in the plan for correction. It helps them to build confidence in responding to real situations. And just as importantly, they help to ensure that responses become second nature. One critical piece of emergency preparedness is communication with parents and guardians. Another interactive activity: in what ways does your camp keep the lines of communication open? If you're a new camp director, drop in the chat how you plan to engage with your camp community, including parents and guardians. So could you all please just drop in the chat ways that your camp fosters communication with parents and guardians? And could you help me out with a couple of responses?
Absolutely. All right, so we have a Remind app coming up,
Oh, that's smart.
text messaging system, ProCare.
Mm-hmm.
Okay, so there's also Bloom's Class Dojo app. There's a number of good communication apps out being suggested. Weekly newsletter and daily communications, registration, email, website, direct communications, weekly surveys, social media. That's a great tool.
Yeah, that's awesome tool. Get to a lot
Weekly,
of people at once.
Oh,
social
yeah.
media. Yeah. All right. Well,
Pre
thank you.
Ooh,
Thank you.
this is a
Thank
good
you,
one.
Ray. Oh, go ahead. Go
Pre-summer
ahead.
open house.
Oh, that's
That's,
great.
yeah.
Get the parents and the kids all together. Let them meet a
Mhm.
little bit, commune.
Yeah, so,
Yeah, that's
yeah,
perfect. I love all of the feedback. I love the idea of utilizing technology through apps or social media to keep your camp communities informed about what's happening at your camp. So routine communication is always good, but in any serious situation, timely and clear communication really helps reduce panic. It builds trust. It ensures accurate information is shared. Keep in mind, parents are entrusting you with their children. How and when you communicate during an emergency matters. Emergency preparedness is about being ready for the unexpected, but it's also about creating an environment where risks are minimized in the first place. So we talked about how to prepare for emergencies and respond when something goes wrong. Now let's take a step back and focus on something just as important. How the physical environment at your camp helps prevent those emergencies from happening in the first place. Every year, we receive data via the annual accident report form, which is required to be submitted at the end of your camp season. We've analyzed these reports and figured out that the most reported accident, one of the most important reported accidents, are trips and falls. This next section focuses on the physical plant and facilities. In other words, your buildings and your grounds. Buildings and grounds should be structurally sound buildings, safe play areas, clear walkways and exits, proper maintenance of equipment and facilities. Now, in the youth camp safety rule, there is no requirement for a building. So your camp can technically operate in a park or in the woods or travel camp. Again, despite how your camp operates, you must ensure that the equipment you're using, the facilities and location of your camp are in a safe environment. These are the spaces where campers spend their time every day, so they play a huge role in overall safety. Youth camp site requirements. The location must not present a fire, health, or safety hazard. They may not be located in private occupied residences. They must be located wherein highway, railroad, and or other traffic could not endanger a child. Must not be located near a highway, railroad, or other traffic. Because I did not say not. Uh, so, camps are responsible for maintaining safe buildings and well-kept grounds. Proper maintenance of equipment and facilities is important. Hazards in the physical environment, like broken equipment or unsafe surfaces, can quickly turn into injuries if not addressed. Each physical facility must have a valid certificate of occupancy. This confirms that the building has been reviewed and approved for its intended use and meets the local safety and building codes. It's another layer of assurance that the space the campers are using is safe and appropriate. Beyond the structure itself, camps must ensure overall campsites and physical facility safety. This includes regular self-inspections to help you identify and correct any hazards. maintaining safe conditions throughout the season, not just at the start of the season. Safety isn't a one-time checklist, it's an ongoing responsibility. Overall, a safe, well-maintained facility sets the tone for everything, from how activities run to how secure your staff, the campers, parents, and the surrounding community feel about your camp operations. Transition from physical plant and facilities is an important part of making sure that your camp overall environment is safe. Now that we've talked about maintaining safe buildings and grounds, making sure that the physical environment supports camper safety, let's move on to another critical part of the environment: food, water, and sanitation. Because even in a well-maintained facility, issues with food handling, water quality, or sanitation can quickly impact the health of an entire camp. The food safety standards, or Chapter 24, is required to be implemented at your youth camp. This includes the proper food storage, safe cooking temperatures, preventing cross-contamination, and maintaining clear preparation areas for food prep. This section focuses on preventing illness through proper food handling, water safety, and sanitation practices. These are everyday operations, but they have a really big impact on camper safety and health. Foodborne illness, or food safety, is essential to preventing foodborne illness, which can quickly spread in a youth camp setting. I think annually we have at least one norovirus outbreak at youth camp. So again, food safety is a really important piece to making sure and ensuring your camp's safety practices are followed and your camp population is safe from foodborne illness. Safe drinking water. Water is required to be potable at a youth camp. For camps that use well water, there are additional requirements. If the water has been dormant or not used for more than 3 months in a well system, the camp must conduct a water analysis before use, maintain those testing results on site, and maintain those records for at least 3 years. Key messages here are that a lot of this comes down to consistency. Safe food handling, clean facilities, and safe water aren't one-time tasks. Just consider them a usual routine part of the daily routine that keeps your campers healthy. Waste disposal and sanitation. Proper waste disposal and sanitation are also key components of this section. Camps must dispose of waste in a safe and sanitary manner and maintain clean facilities, including kitchens, bathrooms, and common areas. Good sanitation practices help prevent the spread of illness and maintain a healthy environment for everyone. So we've talked about keeping campers safe within the camp environment through food, water, and sanitation practices. Now let's look at what happens when campers leave that environment. Our next section focuses on transportation and offsite trips, where planning and supervision become even more critical. Anytime campers are transported offsite, camps take on additional responsibility. The section focuses on ensuring that transportation is safe, properly regulated, and well planned. First, let's talk about driver qualifications. Anyone transporting campers must meet the appropriate requirements to safely operate the vehicle they are driving. The Youth Camp Safety Rule requires drivers to have a P&S endorsement and a CDL. The provision is a requirement of the New Jersey Department of Motor Vehicles. and is part of reducing the risk before the trip even begins. If you have questions about the CDL requirement, please contact the New Jersey Department of Motor Vehicles. Oops. All vehicles used to transport campers must be inspected by the school bus inspection unit through the New Jersey Department of Motor Vehicles. Those vehicles must be properly inspected, display valid inspection stickers, be properly insured. Evacuation drills must be conducted at least monthly, and record keeping, which includes the driver's license, insurance documentation, transportation locations, name and contact for any contracted bus services, should be kept on file. Trip planning and emergency preparedness. Every off-site trip must be carefully planned. This includes having a clear itinerary, keeping a first aid kit available for use in the case of an emergency, bringing the emergency contact information for all the campers, and ensuring staff are prepared to respond if something unexpected happens. Transportation and off-site trips must also be properly documented as outlined under subsection 8 of the Youth Camp Safety Standards. Again, documentation helps ensure accountability and provides a record that trips are being conducted safely and in compliance with the regulation. Both on and off-site supervision ratios are important to maintain within your camp environment. Here we have listed the supervision ratios per 8:25-3.2. Maintaining appropriate supervision ratios is just as important off-site as it is at the camp. Staff must be able to effectively monitor and account for all campers at all times, especially in unfamiliar environments. Although this slide details the regs, you can find the supervision ratio requirements at subsection 3.2. So the key message here is when campers leave camp, your responsibility doesn't decrease, it increases. Safe transportation and well-planned trips ensure that the campers can have an experience while staying protected. We're nearing the end. We're in the home stretch, folks. Only 2 more sections to go of the rule. So now let's focus on what campers are actually doing, especially activities that carry a higher level of risk. This brings us to the waterfront and high-risk activities section. Motor vehicle crashes cause more deaths than other causes of unintentional injury for children. Overall, unintentional injury death rates in rural areas were higher than metro and urban areas. Drowning is still the leading cause of injury and death for children aged 1 to 4. Which is why high-risk activities include drowning. Swimming, not drowning. Swimming, boating, horseback riding, and ropes courses. For any high-risk activity, camps must ensure that someone with appropriate experience or credentials is involved. For example, if your camp offers horseback riding on site, you should have someone who is knowledgeable in horse care and rider safety. If campers are taken off-site to a facility for an activity like horseback riding, the facility must have qualified staff on site. However, for the off-site activity, the documentation from the provider is not required to be maintained as part of your camp's internal records. Waterfront activities require some of the most stringent safety measures. We're required to have qualified lifeguards on duty, use of a buddy system, regular and routine buddy checks to account for all swimmers, and clearly defined waterfront emergency procedures. These layers work together to ensure that every camper is supervised and accounted for at all times. Waterfront program requirements for on-site your camp activities. Again, you're required to have credentialed staff, lifeguard supervisors, and lifeguards. Swimmer assessment, buddy checks every 10 minutes, written lost swimmer plans and procedures. Additionally, for instructional swim at a youth camp, 1 lifeguard and 2 adults, or 1 adult lifeguard and 2 counselors are required to be on duty during instructional swimming when there are 30 or fewer campers in the water. 1 additional lifeguard is required for each additional 30 count of campers. For open swim, a lifeguard supervisor and 1 lifeguard should be on duty during non-instructional swimming when there are 30 or fewer campers in the water. As it relates to watercraft or boating activities, occupants must be supplied personal flotation devices, a lifeguard in a lifeboat, or in a rescue craft with another adult observing the watercraft activity from a vantage point on the shore for the supervision of boating on lakes, tidal waters, and ponds. The lifeboat or rescue craft shall be equipped with a rescue ring or similar device, which is attached to a minimum 25 feet of rope. Please review subsection 9 for specific additional details. Waterfront program activities offsite. Let's say you're going to some big swimming or state park. Let's say we're going to a state park. We're taking our youth camp to a state park. You want to ensure that your campers, that the camp uses a licensed or inspected recreational bathing facility. You cannot conduct offsite activities at a non-inspected recreational bathing facility. Operators must contact the public recreational bathing facility prior to attending to ensure that they have the capacity to oversee your camp group. When using offsite pools or waterfront camps, you want to plan ahead and coordinate with the facility. Advanced planning helps prevent overcrowding, ensures a safe experience for everyone. You also want to do buddy checks every 10 minutes and conduct a swimmer assessment so that you know where your camp population is. If they're a beginner or advanced, you want to have that documented so your staff know how or where your campers should be in the water. As with all activities, appropriate supervision ratios must be maintained, especially during high-risk activities. Staff must be able to actively monitor campers and respond quickly if needed. The current recognized certification listing identifies organizations that offer recognized training that meets the requirements of various personnel required through the rule, like lifeguards and health directors. This current recognized certification list is available on our website. Now we're switching gears to pest control and mosquito management. Along with managing activity risk, camps also need to be aware of environmental factors that can impact health and safety. Camps must take steps to manage pests and mosquito breeding habitats. Reducing standing water and maintaining clean grounds can significantly lower the risk of insect-borne illnesses. Proper waste management is essential to maintaining a clean, and healthy environment. Waste should be handled and disposed of in a way that prevents odors, reduces pests, and maintains overall sanitation. For camps that have livestock or petting zoo type activities, there are additional considerations. Camps must ensure animals are safely housed. Food and sleeping areas are kept separate from animal areas. This helps reduce the risk of contamination and illness. Camps should promote and provide opportunities for proper hand hygiene, especially after contact with animals, before eating, after using the restroom. These all play a major role in minimizing the spread of disease. As mentioned before, the youth camp inspection and enforcement process is a key piece of ensuring that your youth camp has implemented the standards as written pursuant the code. The program has two facets of inspection and enforcement. The pre-operational inspection is conducted by your local health authority. They must be conducted before campers are on site. The camp operator is responsible for contacting the local health department at least 3 weeks prior to opening. Inspection must be performed by the local health department in the camp's operating jurisdiction. And essentially, this pre-operational inspection is a desk audit of the policies, procedures, site, and a site visit is available. Essentially, the pre-operational inspector wants to ensure that the site is suitable for your camp operations. Secondarily, the operational inspections are conducted by the NJDOH Youth Camp Safety Project, which is us who is holding this meeting. We have a cadre of 18 or so inspectors located strategically throughout the state in different counties who conduct these operational inspections annually. Operational inspections are unannounced. Once you submit your application to operate, that is the trigger that you will be inspected for operational inspection. Operational inspections can also be triggered by complaints and conducted as, routine oversight. They occur during the camp season while campers are present. They focus on verifying implementation and compliance with the youth camp safety standards. During your operational inspection, youth camp operators, in violation of the provisions of the Act of this chapter, may have their certificate of approval revoked and may assess a civil administrative penalty can be assessed. $1,000 per day upon notice and hearing. So let's go over a few tips for streamlining your on-site inspection. You want to have designated and prepared staff. Multiple on-staff leads knowledgeable in the full camp operations is helpful when your inspector arrives. we suggest at least 2 designated health directors on site at all times with professional level CPR. Again, the rule only requires you to have a health director. However, the health director must be on site at all times. So in case of illness or calling out or whatever, we don't know what will happen, but you definitely want to have someone who's prepared to address health concerns at your camp at all times.
A question that's popped up a few times about this. Can the health inspector be doing anything besides being a health inspector? Can that position overlap with another position?
The health director?
Yes.
So a health director cannot serve in multiple, the camp director may not serve as the health director at camps serving more than 50 children. The
Can
health director, the health director should be dedicated to the health director role throughout the camp, unless you have under 50 kids, wherein that person can be the camp director as well.
Thank you.
Yep. Documented staff trainings and orientation records should be maintained. And as we discussed in the beginning, current background check verification logs should be maintained as well. You want to make sure that your documents are organized and accessible. Again, here we go, centralized inspection binder. It makes things so much easier. We know that you're dealing with maintaining your camp community. You're dealing with activities. You're dealing with 50. You're dealing with 20. You're dealing with however many campers you have on site. But the inspection process is a part of licensure. So you'll have to deal with that as well. Staff certifications like CPR, first aid, and health director credentials should be maintained on site. Additional tips: safety and emergency preparedness. You must have documented fire and emergency evacuation drill information, written emergency plans, up-to-date emergency contact information, posted evacuation routes, and emergency procedures. To prepare yourself, pre-inspection readiness. Conduct your own internal mock inspection walkthrough. Schedule your pre-operational inspection with your local health department. Ensure required postings are visible and verify all forms are current and signed. Lastly, you want to confirm that facilities meet safety standards, playgrounds, pools, activity areas. All are in compliance. Overall, the rules we've discussed during today's presentation are dedicated to protecting our most vulnerable populations, which are children from illness and injury. These minimum standards represent. We don't do this work alone. We work alongside many stakeholders or partners. And I want to take a moment to highlight a few important partnerships that support your work as camp operators. Our collaboration with the New Jersey Department of Environmental Protection, or NJDEP, is one of those partnerships. NJDOH and NJDEP work closely together to protect public health, especially when it comes to environmental conditions that can impact children in camp settings. While the NJDOH focuses on health standards, safety, and oversight of youth camps, NJDEP provides critical environmental data and tools that help identify and respond to risks. This partnership allows us to take a more proactive approach, not just responding to issues, but helping you prevent them before they impact your campers. As many of you are aware, extreme heat is becoming more frequent and more intense. Heat is one of the leading causes of preventable illness and injury each year, particularly in urban areas where there's less green space and more heat retaining infrastructure. For youth camps, this is especially important because children are more vulnerable to heat-related illness, and outdoor programming increases with that risk. To support planning and response, NJDEP has developed a tool that you can use to monitor conditions and make informed decisions for your camp operations. That would be the Chill Out New Jersey app. You can visit their website by Googling Chill Out New Jersey. We spend a lot of time outside at camp, running and playing and exercising. The air we breathe can sometimes contain pollutants like ozone and particulate matter 2.5, which can affect health, especially for children, teens, those with asthma, heart or lung conditions, and older adults. By checking local air quality forecasts, staff can make simple adjustments, like limiting strenuous outdoor activities so campers stay safe while enjoying their time outside. NJDEP's FLAG program can help by alerting you when air quality in your area may be adverse. Please visit their website located here for more information on the FLAG program and how you can participate. Okay. Another tool is the Chill Out New Jersey website. There's an interactive map that helps users to quickly locate cooling centers and other places to get relief from extreme heat across the state. By identifying nearby cooling locations during extreme heat events, supporting emergency planning if your camp needs to relocate or provide relief. Helping staff and families stay informed during these heat advisories. It's simple, but it's a powerful resource that can help you to proactively plan for high temperature days. Another important tool developed and administered by the NJDEP is the beach management system. This system provides real-time information on the status of public beaches across New Jersey, including whether the beaches are open or closed due to water quality concerns. For camps that use recreational bathing facilities, whether at the shore, lakes, or other public waters, this tool is critical. It allows you to check water quality conditions before trips, avoid exposing campers to unsafe recreational waters, make quick adjustments to your schedule if conditions change. At the end of the day, these tools and this partnership are all about protecting the health and safety of the children under your care. By using available environmental data and planning ahead, you can respond more effectively to changing conditions and ensure your campers have a safe experience. We encourage all operators to familiarize yourselves with these resources and incorporate them into your daily operations and emergency planning. Another important partner is the Department of Human Services, specifically the Division of Family Development, or DFD. DFD oversees and administers the state's child care subsidy program, which helps eligible families cover the cost of child care and camp services. Many camp operators interact with the DFD through subsidy payments, so this is a familiar program to a lot of you. That said, I want to clearly highlight an important distinction because this is an area where we often see confusion. The Youth Camp Safety Program under NJDOH is a licensing and enforcement authority. Our role is to ensure that camps are operating safely and in compliance with NJAC 8:25, which is the Youth Camp Safety Rules. On the other hand, the DFD is a benefits and funding agency. Their role is to provide financial assistance to families and process subsidy payments to eligible providers. So while both programs may involve camps, our functions are very, very different. A helpful way to think about this: NJDOH is like the Department of Motor Vehicles, and DFD is like an auto insurance provider. The DMV makes sure you are licensed to drive and that you're following the rules of the road. That's enforcement and oversight. Insurance, on the other hand, helps cover the cost of driving. It provides financial support, but it doesn't determine whether you're allowed to operate. Much in the same way, NJDOH determines whether your camp can legally operate and ensures it's safe. DFD helps families to pay for camp, but it does not license or regulate your camp operations. Why does this matter? Because understanding this distinction is super important. Any camp that meets the definition of a youth camp under NJAC 8:25, the Youth Camp Safety Rules, is required to register with the NJDOH and comply with the applicable health and safety regulations. Participation in the subsidy program through DFD, however, is optional. Camps may choose to work with DFD to accept subsidy payments, but it is not a requirement to operate. Because of this, a camp must be properly licensed and complying with NJDOH regulations, regardless of whether they participate in the subsidy program or not. At the same time, many camps choose to work with both agencies, supporting families financially through DFD while maintaining safe and compliant operations under NJDOH. Overall, camp operators are responsible for ensuring they meet all licensing and safety requirements, regardless of whether they accept subsidy payments. At the same time, we recognize that many camps work with both agencies. And that's where this partnership comes in, serving families and protecting children from different but complementary angles. That said, DFD is offering a training on Thursday, April 16th from 10 to 11:30 to talk about their program. Please access the QR code if you would like to participate. Key takeaways. Let's quickly bring everything together and highlight the key takeaways from today's meeting. At the end of the day, the youth camp safety standards are about one core goal: protecting the health, safety, and well-being of every camper. Safety at the camp isn't just one thing. It's a combination of prepared staff, clear plans, safe environments, and consistent daily practices. From health records and emergency preparedness to food safety, supervision, and high-risk activities, every standard plays a role in creating a camp experience where kids can thrive. And most importantly, when these standards are followed effectively, they don't take away from the camp experience. They're what make this camp experience fun, memorable, and positive. Now, let's go to the Q&A section. I can imagine that we have quite a few questions in the chat, and I will be happy to answer a few of those questions now. Anne,
I've got a few picked out already.
Okay, perfect.
All right. First, can you put the training code back on the screen so that a few people can grab that? Just go
Good.
back one slide.
Go back one slide, okay.
Or to the DFD training slide.
Oh, yep. Mm-hmm.
All right. So, first question. Do we need to have our campers and staff health records printed out in a binder, or can we have it digitally?
Yes, electronic records, either or is up to your preference. Electronic records are absolutely acceptable. If you are maintaining electronic records, you want to make sure that someone on your staff has access to these electronic records in case there is an emergency or there needs to be access for your inspector. But yes, electronic records are encouraged, actually. Let's save some trees.
Yes. All right. So for camps that have over 50 campers at it, are we saying that a camp counselor cannot be a health director and that I have to hire a person just for that position?
Yes, health director should not hold another role. This health director has to be dedicated on site at all times.
Okay. There have been a lot of questions about just clarifying what background check is required for day camps.
For day camps, the 50 state background name check is required. In
And
this, Mhm.
and that can be found at Identico, or is that the one on the Department of Justice website?
Great question. So the 50 state name check is not identical. 50 state name check is a background check that can be completed by any vendor of your choosing. Because we've gotten so much feedback about what the 50 state name check is about, we've compiled a list. This list has not been vetted. It is still your responsibility to reach out to these providers, these vendors, to make sure that their background check complies with the rule. You want to make sure that that the background checks includes 50 states, including New Jersey. And you want to have them document what databases, etc., the components of the check are included, and keep that documentation with you.
All right, and the vendor list will be sending out after this meeting.
The vendor list is actually it's going to be posted on our website, so that should be. I asked for it to be posted earlier this week, and I can imagine that it'll probably be posted by the end of the week. So that should be available on our website shortly.
Okay. So there have been a few questions about, can we have minor counselors who are 14 or 15? We've been talking, we have used the language 16 plus in our presentation, and that's been a little confusing for some individuals.
And to add
Great.
on to that,
Mhm.
is in reference to what was posted last year with the New Jersey Department of Labor and New Jersey Department of Health commissioners.
Got you. Joint statement. Okay. Really great question. So the youth camp safety standards specify that camp staff minimum age is 16. However, we know that camps often bring on board campers in training. Now, you have to remember that these campers in training, those folks under 16, are not cannot be considered your camp staff. They can be campers in training, but they're considered campers from our perspective. You're not hiring those folks to oversee your camp community because they are not old enough pursuant NJAC 8:25 youth camp safety standards to oversee camp communities. So again, your camp staff have to be minimum age 16 to work at your camp. If you employ those folks underage, or if you allow for those folks underage, you will consider them campers. Those 14, 15-year-olds, they are considered campers. They are not included in your supervision ratios.
Okay.
Oh, and what last thing is, as it relates to the Department of Labor's communication about working papers, etc., please reach out to the Department of Labor as it relates to those specific questions for working papers that you have questions about.
Also reach out to them if you have questions because someone did not pass a background check and you need to let them go because we've had that pop up once or twice. Talk to them. I think that covers all of the main topics being questioned.
Okay. All right. If we didn't answer your question live, no, don't fret. I'll be happy to answer those questions using the Q&A function. Please enter your questions in the Q&A function. We'll be sharing the Q&A data with the Communicable Disease Service as well, and any partners where you have questions, so that we can have a FAQ that addresses any questions that we've received during this training. Your feedback is so important for this program. So please, if you have the opportunity, complete the post-event feedback survey. Scan this QR code to take you to the survey for your feedback. I want to thank you all for your time today. I hope that you found the material in this meeting both informative and worthwhile. I know you may still have questions. Hopefully they're minimized at this point, but if you do, please add that information to the Q&A. The video recording of the session will be made available once all approvals have been received. If you have any questions, please submit them in the Q&A section. We'll compile these responses, provide an FAQ to follow up on anything discussed today. We should have already added a FAQ, which was generated during our Key Changes webinar hosted a few weeks ago. That FAQ was submitted or forwarded to all our of the Key Changes webinar and should be added to our chat today. I hope our staff.
Unfortunately, it's not allowing me to drop the file into chat.
Okay, gotcha. So
it'll be emailed out.
Yeah, it will be emailed out at the same time when we send out the FAQ for this meeting. Let's see. The video from the Key Changes webinar is still pending approval, but once it is approved, we'll post it on our website. We also developed and posted a random list of vendors who conduct 50 state name checks, background name checks, and that should be posted on our website very shortly. Thank you to all the stakeholders who sent in recommendations about that 50 state check. I really appreciate your help developing that list. Please email us directly with any really specific nuanced questions you may have about your specific camp or camp activities. Again, before you go, please take a moment to complete the follow-up survey using the QR code on the screen. We really appreciate and value your feedback. It helps us create the materials you need to stay in compliance and run safe, successful camps. I want to thank you. My team wants to thank you, and have a great summer. Yes.